Today I'm going to answer a question asked by a viewer. What are IVF injections and why they are given? Hello everyone, I'm Dr. Prachi Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. So most of the patients are usually scared of IVF injections. So I want to clear the myths around the IVF injections, and I also want to share the information why these injections are required in IVF. Now IVF injections we can divide into two types. First ones are given during the stage of stimulation of the ovaries, which are called ovarian stimulation injections or commonly known as IVF injections. Second one which we give are after the embryo transfer to support the pregnancy, which are mostly progesterone injections. So now coming to each one. First one which are for ovarian stimulation, which means in the IVFs when we want to develop multiple eggs in your ovary, we have to give you injections which are given for approximately 10 to 12 days. Some patients eggs may be ready in less number of days like 9 days. Some patients may even require little longer like 12 to 14 days of injection. So how we decide which patients require how many days? Based on how your response to stimulation is, which means we do scans in between the stimulation cycle. From the first day when we do the scan, we decide a particular dose of injections. Once that dose is started, we wait for 5 days to check your response to stimulation, which means how many follicles in the ovary are growing and how they are growing. So after initial 5 doses of injections or 5 days of injections, we do again a transvaginal scan to check the follicle sizes and number. If the response is adequate, which means whatever number of follicles we saw on starting of stimulation, all of them are growing adequately, then we continue the same dose. If the response is not adequate, then we may alter the dosage, we may add some injections, and after that we again continue doing scans at the interval of 2 days, or maybe towards trigger it might be immediate next day. So what we check on the ultrasound scan before trigger is how many follicles are between 16 to 20 mm. So 16 to 20 mm is considered as a cohort or a group of follicles which will give mature eggs. So if your maximum number of follicles are between 16 to 20 mm, then we give you trigger injections because we are expecting mature eggs from this size of follicles. If the follicle size appears to be smaller on 10th day, we may give another 1 or 2 days of injections so that the follicles continue growing and we can get the maximum number of follicles between 16 to 20 mm. So this particular size we expect mature eggs to come. So after the trigger injection, we do the egg pickup procedure where we will know exactly how many follicles gave me eggs and out of how many retrieved eggs are mature eggs. So this initial part which injections we are giving are known as gonadotropin injections. There are different varieties in gonadotropins. In initial days when the IVF had started, there were urinary derived human menopausal gonadotropins. Then the highly purified gonadotropins came, and after that recombinant injections which are used now are recombinant injections. So these are the gonadotropin injections, which are mainly HMG or human menopausal gonadotropin, or FSH, which is follicle stimulating hormone, LH, which is luteinizing hormone, or a combination of these both. So these are the hormones which in your body pituitary gland secretes. So these are the hormones which are actually present in the body but at a lower level because naturally body develops one egg. And when in IVF we want multiple eggs to grow, we want to give a dose which is sufficient to develop those many eggs. So this is the reason why we need to give injections in IVF. So once these injections are started, there's one more type of injection which we use in IVF in some protocols, which is known as antagonist injection. Why we add an antagonist? Because when we are growing multiple eggs, there is a risk because of the level of hormone estrogen going high the body may release the eggs prematurely or in the body itself, and we may not be able to retrieve the eggs. So to prevent this premature release of eggs in the body, we add this antagonist injection, which will prevent this release of eggs until the egg pickup. So this antagonist also has a function that it prevents the release of the eggs. Gonadotropins help the eggs to continuously grow. So these two types of injections we give in IVF for 10 to 12 days gonadotropins, maybe 5 to 6 days antagonist. Other types of injection which we give are trigger injections, which means the final maturation stage of the eggs and the release of the egg. But we plan our pickup just before the release of the egg. So trigger injection, what is more important is the dose, the time and cold chain maintenance. All these injections are hormones, hence cold chain maintenance, which means temperature maintenance, is very important. Therefore, it is important that you take injections from a reliable source or from the clinic itself, and from the person who is aware of how to exactly put the dose in the syringe and give you the exact dose. Because if anything goes wrong, like temperature is not maintained properly, correct dose is not given, injection is not given in the correct way, like subcutaneous or intramuscular, then the response may not be enough to get good number of eggs, and your IVF cycle outcome may get affected. So it is important to take the injections from the reliable source where the cold chain is properly maintained and correct dosage is given. Same goes for the trigger injection. So these are the injections which are used in IVF. Now, why do we need to give these injections daily? Because the action of this injection does not last more than 24 hours. That is the reason why we have to give these injections daily till your eggs become of a particular size. So these injections, do they have any long-term effects? So these are similar to your brain hormones, which is FSH and LH, which are naturally present in the body. So they do not have any direct side effects. Some patients may have some allergic reactions or itching or redness at the injection sites, but most of the patients do not have any reactions to these injections, and there are no long-term effects of these injections. Usually, IVF, the side effects may be because of high levels of estrogen, which is produced in your ovaries when so many eggs are developing. But there are different ways to take care of those side effects, and most of the patients tolerate these injections and IVF process very well. Also, there are some particular protocols where these risks can be reduced, or recombinant injections where these side effects or complications do not occur, or recombinant injections where these side effects can be limited. So this is about the IVF injections, which are stimulation injections. Now coming to the second type of injections, which are progesterone. Now, why do we have to give progesterone for IVF? Because most of the IVF cycles nowadays are frozen embryo transfer, which means your embryos are created outside the body in a different cycle, and we are planning an embryo transfer in a different menstrual cycle. So your body does not have the hormone, which is progesterone, to support the pregnancy. Hence, we have to add the progesterone. Also, when the patients who are undergoing IVF, many of them will have issues related to the hormones, which are known as luteal phase deficiency, may be related to their endometriosis, high prolactin levels, thyroid, polycystic ovary. All these conditions are associated with luteal phase deficiency, which means your body may not produce enough progesterone to support the pregnancy. Hence, we have to add good level of progesterone to support the pregnancy for at least initial 2 to 3 months. So based on how the pregnancy advances, how many embryos are implanted, your doctor decides till what time you need to take these progesterone injections. Now these progesterone injections are also given daily, and there are alternatives to progesterone injections also. There can be vaginal progesterone in the form of gel or tablets, or even oral progesterone tablets. But fertility specialists will decide based on your case what is best for you. Most of the times injectable progesterone will maintain a good level of progesterone in the blood. That is the reason why these injections can be preferred for your case. So these are the injections which are given in IVF, like gonadotropin injections for ovarian stimulation and progesterone injections for pregnancy support up to 2 to 3 months of pregnancy. I hope this was helpful. Thank you.